heart disease, a term that encompasses various cardiovascular conditions, has emerged as a leading cause of morbidity and mortality across the globe. With advancements in medicine and technology, the understanding of heart disease has evolved significantly, transitioning from a simplistic view of heart ailments to a complex recognition of the myriad factors influencing cardiovascular health. According to the World Health Organization (WHO), cardiovascular diseases account for approximately 31% of all deaths globally, emphasizing the urgent need for effective prevention, diagnosis, and treatment strategies. This alarming statistic serves as a wake-up call for healthcare professionals, researchers, and the public alike to address the growing epidemic of heart disease with an urgency that reflects its impact on individuals, families, and communities. The multifaceted nature of heart disease encompasses several distinct conditions, including coronary artery disease (CAD), heart failure, arrhythmias, valvular heart disease, and congenital heart defects, among others. Each type presents its own unique challenges and requires tailored approaches for effective management. For instance, CAD, characterized by the narrowing or blockage of coronary arteries due to plaque buildup, can lead to significant health complications, including heart attacks and angina. Understanding the specific characteristics and risk factors associated with each type of heart disease is crucial for both prevention and treatment. Risk factors for heart disease are equally diverse and can be categorized into non-modifiable and modifiable factors. Non-modifiable risk factors include age, gender, and family history, while modifiable risk factors encompass lifestyle choices such as diet, physical activity, smoking, and stress levels. The interplay between these factors contributes to the overall risk of developing heart disease, underscoring the importance of comprehensive risk assessment in clinical practice. For instance, individuals with a family history of heart disease may be at higher risk, yet lifestyle modifications can mitigate some of these risks. This highlights the critical role that both personal choices and genetic predisposition play in cardiovascular health. Moreover, heart disease does not solely affect the physical health of individuals. It has profound psychological, social, and economic implications as well. The emotional toll of living with heart disease can lead to anxiety and depression, which can further exacerbate physical health problems. Social isolation may arise from the limitations imposed by cardiovascular conditions, creating a cycle that perpetuates both mental and physical decline. Economically, the burden of heart disease extends to healthcare systems, impacting resources, accessibility, and the overall economy due to lost productivity and increased healthcare costs. As our understanding of heart disease continues to grow, so does the emphasis on preventive measures and early intervention. Public health initiatives aimed at educating individuals about heart health, promoting healthy lifestyles, and facilitating access to healthcare are vital components of an effective strategy to combat heart disease. Educational campaigns that raise awareness about the importance of regular health checkups, screenings, and lifestyle modifications can empower individuals to take charge of their cardiovascular health. Additionally, advancements in technology, such as telemedicine and wearable health devices, offer innovative ways to monitor heart health and facilitate early detection of potential issues. In the realm of treatment, the landscape of heart disease management has evolved significantly over the years. Medical professionals now have access to a diverse array of treatment options, ranging from lifestyle changes and medication to surgical interventions and rehabilitative therapies. For instance, medications such as statins and antiplatelet agents play a crucial role in managing cholesterol levels and preventing blood clots, while surgical procedures like angioplasty and bypass surgery are employed to restore blood flow in cases of severe blockage. Furthermore, the integration of physiotherapy into cardiac care has emerged as an essential aspect of recovery and rehabilitation, helping patients regain strength and improve their overall quality of life. Physiotherapy offers a holistic approach to managing heart disease, focusing on individualized exercise programs, education, and support. Through tailored exercise regimens, patients can enhance their cardiovascular fitness, reduce symptoms, and improve their functional capacity. Moreover, physiotherapists play a vital role in educating patients about heart health, teaching them how to manage their conditions effectively, and providing emotional support during their recovery journey. This collaborative approach, which emphasizes both medical and rehabilitative care, is paramount in ensuring that patients receive comprehensive treatment for their heart disease. The journey of understanding and managing heart disease is ongoing, and the importance of research and innovation in this field cannot be overstated. Continued exploration of the underlying mechanisms of heart disease, the development of new therapeutic strategies, and the implementation of effective public health initiatives will be essential in combating this pervasive health issue. Collaborative efforts among healthcare providers, researchers, policymakers, and communities will pave the way for a more comprehensive approach to cardiovascular health, ultimately leading to better outcomes for individuals affected by heart disease. In conclusion, heart disease represents a significant public health challenge that requires a multifaceted response. Through an understanding of its complexities, including types, risk factors, complications, and treatment options, we can work toward reducing its burden on individuals and society. By fostering a culture of awareness, prevention, and proactive management, we can create a future where heart disease is less prevalent, and those affected can lead fulfilling and healthy lives. Types of heart disease. Coronary artery disease (CAD) occurs when the coronary arteries become narrowed or blocked due to plaque buildup, leading to reduced blood flow to the heart muscle. Risk factors include high cholesterol, smoking, hypertension, and diabetes. Symptoms may manifest as angina, chest pain, shortness of breath, and fatigue. Diagnostic methods such as angiography and stress tests are often employed to assess the severity of the disease. Management. Treatment may involve lifestyle modifications, medications such as statins, and procedures like angioplasty or coronary artery bypass, grafting CABG. Heart failure. Heart failure refers to a condition where the heart is unable to pump sufficient blood to meet the body's needs. It can be classified into systolic, reduced ejection fraction, and diastolic, preserved ejection fraction, heart failure. Symptoms typically include fatigue, fluid retention, and difficulty breathing. Management. Heart failure management often includes diuretics to reduce fluid overload, ACE inhibitors to improve heart function, and lifestyle changes such as dietary modifications and regular exercise. Arrhythmias are irregular heartbeats that can lead to various symptoms, including palpitations, dizziness, and fainting. They may arise from issues within the heart's electrical system, which can be affected by ischemia, electrolyte imbalances, or structural changes. Management. Treatments may include medications, antiarrhythmics, lifestyle changes, or procedures like catheter ablation to restore normal heart rhythm. Valvular heart disease involves dysfunction of one or more of the heart's valves, resulting in stenosis, narrowing, or regurgitation leaking. This can lead to increased cardiac workload and subsequent heart failure if not addressed. Symptoms can range from asymptomatic to severe fatigue and breathlessness, depending on the severity. Management. Treatment options include medications to manage symptoms and surgical interventions, such as valve repair or replacement, are indicated for significant cases. Congenital heart defects are structural abnormalities of the heart present at birth. They can range from simple defects, such as septal defects, to complex anomalies requiring surgical intervention. Symptoms may vary based on the type and severity of the defect and can include cyanosis, rapid breathing, and poor weight gain. Management may involve surgical repair during infancy or childhood, as well as lifelong follow-up care to monitor heart function. Cardiomyopathy refers to diseases of the heart muscle that can lead to heart failure. Types include dilated, hypertrophic, and restrictive cardiomyopathy, each with distinct pathophysiological mechanisms and clinical presentations. Management. Treatment focuses on controlling symptoms, preventing complications, and may include medications, lifestyle changes, and in some cases, heart transplantation. Heart disease can lead to a wide array of complications, affecting not only cardiac health, but also overall well-being. Below are at least 15 problems commonly associated with heart disease. Heart attack. Myocardial infarction occurs when blood flow to a part of the heart is blocked, resulting in damage to the heart muscle. Stroke. A decrease in blood flow can lead to strokes, particularly in patients with arrhythmias like atrial fibrillation, which increases clot risk. Heart failure. Chronic heart disease can progress to heart failure, significantly impairing quality of life and functional capacity. Cardiac arrest. Sudden cardiac arrest may occur due to life-threatening arrhythmias, necessitating immediate medical intervention. Thromboembolism. Formation of blood clots can occur in patients with heart disease, leading to potential complications such as pulmonary embolism. Valve problems. Damage to heart valves can lead to stenosis or regurgitation, impacting overall cardiac function. Increased risk of diabetes. There is a reciprocal relationship between heart disease and diabetes, with one condition exacerbating the other. Cognitive decline. Reduced blood flow to the brain from heart disease can contribute to cognitive impairment and dementia. Kidney damage. Poor heart function can lead to reduced blood flow to the kidneys, resulting in renal impairment. Peripheral artery disease. PAD-CAD can extend to peripheral arteries, causing pain and mobility issues in the legs. Lung complications. Congestive heart failure can lead to pulmonary edema, causing breathing difficulties and complications. Fatigue and weakness. Chronic heart conditions can lead to persistent fatigue and weakness due to reduced oxygen delivery to tissues. Anxiety and depression. The physical limitations imposed by heart disease can lead to significant psychological distress, affecting overall health and recovery. Decreased quality of life. The cumulative effect of symptoms can significantly impact an individual's ability to engage in daily activities and enjoy life. Social isolation. Patients with heart disease may experience social withdrawal due to physical limitations or psychological barriers. Proper care and lifestyle modifications are essential for individuals with heart disease to manage their condition effectively. Here are 15 critical care considerations. Regular medical checkups. Routine appointments with healthcare providers to monitor heart health and adjust treatment plans as needed. Medication adherence. Strict adherence to prescribed medications to manage symptoms and prevent complications. Heart-healthy diet. Emphasizing fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting processed foods, salt, and sugars. Weight management. Achieving and maintaining a healthy weight to reduce cardiac workload and improve overall health. Regular physical activity. Engaging in regular, doctor-approved exercise to enhance cardiovascular fitness and strength. Smoking cessation. Quitting smoking to improve cardiovascular health and reduce risk factors. Stress management. Incorporating stress reduction techniques such as mindfulness, meditation, or yoga to manage emotional well-being. Alcohol moderation. Limiting alcohol intake to promote heart health and prevent interactions with medications. Monitoring blood pressure. Regularly checking blood pressure at home or during medical visits to ensure it remains within target ranges. Blood sugar control. For patients with diabetes, maintaining optimal blood glucose levels to prevent complications. Cholesterol management. Regular lipid panel tests to monitor cholesterol levels and adjust lifestyle or medications accordingly. Education on heart disease. Understanding the condition, recognizing symptoms of worsening disease, and knowing when to seek medical attention. Support groups. Participating in support groups to connect with others facing similar challenges and share coping strategies. Hydration. Maintaining adequate hydration while monitoring fluid intake in cases of heart failure to prevent fluid overload. Emergency preparedness. Being aware of symptoms that warrant immediate medical attention, such as chest pain or severe shortness of breath. Heart disease can lead to several specific problems within the heart itself, which can exacerbate existing conditions and create new challenges. Myocardial ischemia. Reduced blood flow to the heart muscle can cause chest pain, angina, and increase the risk of heart attacks. Heart muscle damage. Prolonged ischemia can lead to irreversible damage and scarring of heart tissue. Decreased cardiac output. A weakened heart can result in insufficient blood pumping to meet the body's needs, leading to fatigue and organ dysfunction. Dilation of the heart chambers. As the heart weakens, the chambers may enlarge, leading to further complications. Thickened heart muscle. Conditions like hypertrophic cardiomyopathy can cause abnormal thickening of the heart muscle, obstructing blood flow. Electrical conduction issues. Structural changes in the heart can disrupt the electrical signals, leading to arrhythmias. Reduced tolerance for exercise. Physical limitations can result from decreased cardiac output and muscle performance, impacting overall health and mobility. Increased workload on the heart. Chronic hypertension and valve diseases increase the workload on the heart, leading to further deterioration. Decreased heart rate variability. Reduced heart rate variability is associated with increased mortality risk in heart disease patients. Development of aneurysms. Weakened heart walls may lead to aneurysm formation, posing risks of rupture and life-threatening complications. Physiotherapy offers essential support in the management and rehabilitation of heart disease. It encompasses a wide range of interventions aimed at improving physical function, enhancing quality of life, and promoting overall cardiovascular health. Here are 15 critical roles physiotherapy plays in treating heart disease. Assessment and evaluation. Physiotherapists conduct comprehensive assessments to determine functional capacity and tailor individualized treatment plans. Exercise prescription. Creating structured exercise programs that consider the patient's abilities and limitations to improve cardiovascular fitness. Education on heart health. Providing information on heart disease, risk factors, and self-management strategies to empower patients. Breathing exercises. Teaching techniques to enhance lung function and oxygenation, especially for those with heart failure or pulmonary complications. Posture and body mechanics. Instructing on proper posture and body mechanics to reduce strain on the heart during activities of daily living. Functional training. Incorporating functional exercises to improve the ability to perform daily activities safely and effectively. Stress management techniques. Teaching relaxation and stress management strategies to support mental well-being and cardiovascular health. Monitoring during exercise. Continuously assessing vital signs and exertion levels during exercise sessions to ensure safety and effectiveness. Community reintegration. Assisting patients in transitioning back to their daily routines and activities following cardiac events or surgeries. Support for lifestyle changes. Encouraging healthy lifestyle choices, including diet, smoking cessation, and physical activity. Pain management. Providing modalities for pain relief and management of symptoms associated with heart disease. Collaboration with healthcare team. Working alongside physicians, dietitians, and other professionals to provide comprehensive care. Motivation and support. Offering encouragement and support to help patients adhere to their rehabilitation programs. Long-term health promotion. Fostering a culture of health and wellness to reduce the risk of future cardiac events through ongoing education and support. Research and development. Engaging in research to advance the understanding and treatment of heart disease through physiotherapy interventions. The complexities surrounding heart disease necessitate a nuanced approach to understanding its impact on individuals and society as a whole. As we have explored throughout this essay, heart disease encompasses a variety of conditions that pose significant risks to health, quality of life, and longevity. With cardiovascular diseases being the leading cause of death globally, the urgency for comprehensive prevention, diagnosis, and treatment strategies has never been more critical. From coronary artery disease and heart failure to arrhythmias and congenital defects, each type of heart disease presents unique challenges that require tailored management approaches. The interplay between genetic predisposition and lifestyle choices underscores the importance of a multifaceted approach to heart health. Recognizing risk factors, both non-modifiable and modifiable, can empower individuals to take proactive steps in managing their cardiovascular health. Public health initiatives aimed at raising awareness and promoting heart-healthy behaviors play a vital role in reducing the incidence of heart disease. By educating individuals about the significance of regular checkups, screenings, and lifestyle modifications, we can foster a culture of prevention that prioritizes heart health at every stage of life. Moreover, the psychological and social dimensions of heart disease must not be overlooked. The emotional burden of living with a chronic condition can lead to anxiety, depression, and social isolation, further complicating recovery and overall well-being. Addressing these psychological aspects through support groups, counseling, and community engagement is essential in creating a holistic approach to heart disease management. It is imperative that we recognize the interconnectedness of physical and mental health, as both play crucial roles in achieving optimal outcomes for patients. The landscape of heart disease treatment has evolved dramatically over the years, with advancements in medical interventions and rehabilitative therapies offering new hope for patients. The integration of medication, lifestyle changes, and surgical options allows for a comprehensive management strategy that can significantly improve outcomes. Additionally, physiotherapy has emerged as a cornerstone of cardiac rehabilitation, helping patients regain strength, enhance functional capacity, and improve overall quality of life. Through individualized exercise programs and education, physiotherapists empower patients to take control of their health and facilitate recovery. As we look to the future, the role of research and innovation in the field of cardiology remains paramount. Continued exploration of the underlying mechanisms of heart disease, the development of new therapeutic modalities, and the implementation of effective public health strategies will be essential in addressing this pressing health challenge. Collaborative efforts among healthcare providers, researchers, policymakers, and communities are vital in creating a comprehensive approach to cardiovascular health that prioritizes prevention, early intervention, and ongoing support. In summary, heart disease represents a formidable public health challenge that requires a multifaceted response. By understanding the complexities of this condition, including its various types, risk factors, complications, and treatment options, we can work collectively to reduce its burden on individuals and society. Through a commitment to awareness, prevention, and proactive management, we can pave the way for a future where heart disease is less prevalent, and individuals affected by this condition can lead fulfilling, healthy lives. The path forward requires a collective commitment to education, research, and compassionate care, ensuring that heart health remains a priority for generations to come.